I wanted to spend the time just looking at these two scenarios and then looking at your actual lab practical grading rubric. I will say it, just as repeated in lab, that this exam will be different than the last exam. You will not have the last treatment notes visible to you, or the actual evaluations, or a summary of the cases until your actual exam date, which is on Monday, the finals week. This is to prepare you for your clinical experience, where you will not have access to treatment notes well before you actually see the patient. It will oftentimes be on that day. So we are providing you that 10-minute time to look at the last treatment note as well as the evaluation. And in that last treatment note, you will have a plan that will be something that you're familiar with. If we look at the actual practical exam rubric for the second exam, S means spring 19. There shouldn't be anything that's really new for you. The scoring is the same as your last practical exam, 1. The change will come in the area of the part of the body that you're going to be treating. Know that this last exam, it focuses on the upper extremity, and particular data gathering related to range of motion and mind muscle testing, as well as the application of PNF techniques and incorporation of some Therax progression and therapeutic exercise as well. So with that in mind, we have kind of changed the format just a little bit, so it just kind of helps you know that you're going to be gathering 2 range of motion, which is consistent with what you have been doing. For the upper extremity, it would be a shoulder or an elbow, and a manual muscle test for a shoulder or an elbow, depending upon the case. You'll do 1 therapeutic exercise. For strengthening, one of those needs to be a PNF diagonal. That will be, your application of a PNF diagonal with the patient as you're practicing in lab and related to your skill check. And then the second will be 1 stretch, and one of those stretches needs to be a PNF technique, the hold, relax PNF technique, one that's appropriate for the particular case. So, for example, if a person has limited elbow extension, you would know that the contract, relax, stretching into elbow extension, the patient will, once that stretch is applied, then there'll be the patient contracting the biceps, and then you take the patient further into a stretch into elbow extension, just as the video showed in what we practice in lab. And so this is where you are using clinical reasoning to make your decisions and to make sure they're consistent with what's in the plan of care and that PTA problem-solving algorithm that goes way back to PTA 100 and PTA 101. So what I would like to see, what Marcia and I would like to see, especially for this final exam, is just some solid exercise progression, stretch and strengthening as well, related to what you have gathered in terms of range of motion and manual muscle testing. So, for example, if a patient has 3 out of 5 shoulder abduction strength, you will be working with that patient against gravity versus in a gravity-eliminated environment, for example. So let's look at a couple of these cases. The important thing to remind you that these are not actual exam scenarios. So I want to call these scenarios versus cases. So when you look at case number 1 or SIG number 1, you have somebody who had a bike accident, and this individual had a fracture of their left elbow. We'll just call it olecranon fracture. They were in a splint or cast, and it's been 2 months. Well, they're no longer in that cast. PT has evaluated the patient. This is not your full evaluation, but you see here what their current range of motion, strength, and functional deficits are. You have the pain rating up here, that they're lacking elbow range of motion on the left side, and they're actually lacking elbow supination as well, and they're quite lacking in elbow strength, flexion and extension. And their functional deficit has been unable to extend their shoulder, elbow, supinate the forearm to dress the lower body. So that should be giving you some idea of what PNF stretch to incorporate. And with each one of these cases, they're going to have also either some neck or low back pain. That is not your primary condition you're treating, but there is going to be a goal related to posture correction, and in terms of posture education, and that static posture, and also with movement. So being able to incorporate spine protection during movement. So it's really, I think, realistic for what you're going to see with somebody who has had a trauma, and a PT will often incorporate the back or the spine in the plan of care when it's relevant. And in both these cases and in your actual exam, there will be some goal related to posture, improvement of posture, as well as spine protection. So it'll allow you to utilize what you learned in PTA 104 and what you applied earlier this term with your spine exam. But the primary gathering of information is going to be about the shoulder or the elbow, as discussed. So here is the short-term goals. Okay, and then we have the actual, let's just focus over here, the actual pain from the actual recent SOAP note, and their objective finding, the assessment, and then the plan. This is what you're going to be looking at for your actual planning of your next treatment, and with your open lab time to be going ahead and treating one of your classmates for a preparation. In serial number 2, we have somebody who has had a rotator cuff tear. They had a repair 3 months ago, so they're going into their 4th month. They're no longer wearing a sling, so they've gotten clearance for exercise and for range of motion. So the PT has gathered some information about their limitations, which you can see are quite a bit of limitation in flexion and external rotation for what is normal. A very weak person as well in terms of shoulder strength. This is their deficit. They're unable to lift their arm, put on deodorant. That should give you some ideas for your PNF pattern, as far as not only the PNF stretch, but also in terms of the PNF pattern you'll be doing, D1 or D2. And then there's a postural component of just a flat, rounded low back, and their reality they have back pain. So the goals are related to increasing range of motion, strength, addressing the functional limitation, and the spine protection principles. And then you have the treatment note that took place at the eval, and then a plan for you to incorporate as well. So I look forward to seeing all of you practicing in our last lab on week 10, as well as just seeing you apply your skill as you take your exam on the Monday of finals week.